Welcome to Make It Make Sense, the podcast where healthcare meets hustle.
That's right. I'm Spring Lane, a nurse practitioner and owner of Exceptional Wellness. I'm your go-to for keeping it real in the trenches of healthcare.
And I'm Kim Lynch, CEO of Metis Health Technologies, and your guide to navigating the big picture of health policy, business strategy, and making it all work for you.
Together, we're longtime operators, business partners, and friends who've seen pretty much all of it. From Capitol Hill to the clinic, we know healthcare can feel like a hot mess.
But it doesn't have to. Each week, we're breaking down the chaos of healthcare now and sharing how you can not just survive, but thrive.
We're making bold moves, new business models, and tips to reclaim your time, money, and sanity.
So whether you're running a clinic, building a business, or just trying to make it all make sense,
check us out at beesandunicorns.com, where you can find the episode transcript, and don't forget to hit subscribe.
Let's dive in and make it make sense.
This podcast is all about sharing ideas and opinions for building better healthcare. It's not for advice. For your healthcare, business, or any other important decisions, consult a qualified expert. And just so we're clear, views expressed here are personal and not official positions of any organization.
I like that we're starting with a cold open. Go, Spring, go. Cold open this morning.
I don't know what a cold open is, but I'm just like
it's like on SNL. And okay, so like I was being coached on this by someone who went to business school. Like, what's your cold open? And I was like, what do you mean? He's like SNL. Like, what? How do you start out? Like from a black screen. Like, what's your opening line to like? Here's the first joke. And I was like, oh, what's your cold open? I don't know. So what's your cold open today? You said you had something in your mind.
Oh, yes. What's in my mind today is I had this conversation. So there's another nurse practitioner in town. We both worked at the same hospital for a lot of years together. Super love and respect her. And now that we're both clinicians, she works in traditional primary care. And I've got this, fun new, I don't want to say advanced model because it makes it sound like it's better than hers. It's really not. She's an amazing provider. But it's different.
Why don't we call it innovative model?
Yeah. Innovative. I like that. And so, I ran into her we had a mutual friend who was graduating with her master's in psychology. And so anyways, we were talking and she's like, Spring, I'm so proud of you for like doing the thing. Like we were talking about how proud of us we are for just trying, because like having your own business and doing the thing is freaking hard. And yes. I was telling her now, about to be celebrating 2 years, right? September 1st will be 2 years. I'm so proud. And I was like, you know what? It has been freaking hard. Yes. Like so hard. They don't lie when they say it's hard. And
yes.
I would not trade it for anything. Like I am so grateful for every bit of it. It's a hard in a totally different way than beating your head against the wall and trying to convince 600 corporate people to do a thing a different way for a year. I'm not at all having any PTSD about that. It's hard, but it's like you're hard because you're doing it. Mm-hmm. You're like taking the steps. You're trying the things.
100%.
You're experiencing the outcomes, and you're like, oh, well, that worked or that didn't work. A lot of that didn't work. A little bit of that worked. And so I was telling her this, and I just want to share this story with you because I was trying so hard to be a good friend in that moment, because she's like sharing a joy, right? Which a good friend would be happy, right? But I'll tell you what I heard after I tell you what she said. So she works for this big hospital, and so very much told every day how to run her life, right? When we originally started talking, it was whenever I was still working, setting up ACOs, and as a nurse practitioner, she was not allowed any quality payments. She was not given any ACO benefits, right?
Mm-hmm. And no revenue sharing. No. Yeah.
No.
Just making that money for somebody else. Yep.
Yeah. And so, at that time I was like, sister, this is, look, I can help you find the numbers. Okay. A lot of that stuff is public, just so you know. Right. So I'm helping her because I'm like, that's unacceptable, right? Like for you to be bringing in revenue, you're not just like a taking from the table. You are bringing money to the table. Right. And she's an excellent provider. Her patients love her. Like I take care of some of her patients. We have some mutual patients because part of what we're providing is the missing piece of healthcare. Right.
Absolutely.
So we get to collaborate, and I hear such great things. She does great lab work. Like, I just love taking care of her patients because I start from really solid place.
Good place. That's awesome.
And so, like, I know she's doing high quality care. She's got a ton of patients, right? She's used to being worked like a dog as a nurse. Sorry, but that's just the truth. Man, especially hospital nurses.
I mean,
Take
I
it.
would be fascinated if anyone argued the opposite. So,
Please
like,
come at me.
listening. Yeah.
Come at me. Let's have a talk. As a 15-year veteran, I can say
Exactly. I'm like, all the nurses in my family, like, no arguments with that.
So, they just kind of do it, right? They just kind of step up
Yeah.
to the plate and do it because they know that
Yeah.
that's like where I've been, what I do, whatever. So she's telling me that over the last 2 years, she's like, they've made a lot of progress at the hospital. They actually are giving a nurse practitioner a seat at the table in the doctor's discussion about revenue and ACO and blah, blah, blah. And I'm hearing this, right? And she's really proud. And I'm proud too, right? That they're giving them a seat at the table. They're sharing in a shared drive now,
Information and-
everybody's
yeah.
RVUs. And she's noticing that she does 3 times the work of like the internal medicine docs and gets paid a third of the pay, right? She's noticing these things, right? There's nothing being done about it, but at least she knows now.
Mm-hmm.
And so I'm hearing this and I can't help but be like, I'm like, okay, I am so proud that they are like finally giving you a sliver of something. And I'm like, also, I am just like a big, I just want to be like, we have a hand sign for that all the way off, take your ducks and swim away. And I was like, sister, I'm just telling you, because she was telling me, she's always wanted to have a practice. She's always wanted to like be in business on her own. And she's not sure if she could do this on her own and that kind of thing. And
Yep.
I hear that from so many excellent clinicians. And I just want to like publicly say, you can do this. Yes, it's hard.
You can do this.
You are also working your freaking ass off. Excuse the language, but I'm just like super passionate about this because it's like, man, what I heard was someone who has been neglected and honestly abused for decades. It was like, they care enough to like see my eyeballs every once in a while. And sometimes I get to come out of my cave. And I was like, that's what I heard, right? Like, and I'm like, you deserve so much more. Like, you are bringing the bacon to the table and they are treating you like a dog. Still, like, I'm glad that they're giving you a seat at the table, but you're like the sweet dog, the one that we like. You're not an equal.
And accepting crumbs and thinking that it's the whole cake is
And you bought the cake.
wrong. Right? Like you made the cake. You baked the cake. Like you are the cake and you're getting crumbs, not the cake. Like
about the crumbs.
But I think, I mean, so 2 things come to mind from what you just said, and I agree so full-throatedly with all of it. I am so proud to support clinicians who want to strike out on their own. I am so proud to help them with the analysis, with the business setup, with literally anything you need to go hang your own shingle because it is possible. It's not easy. But to this story, the 2 things that come to mind is 1, a Teddy Roosevelt quote that I'm going to not get fully right, but it is not the critic who counts. It's not, the one who points at the man who stumbles or the doer of deeds that, and has like, here's how they could have been done better. Like the credit belongs to the person in the arena whose face is sweaty and covered in blood and strives valiantly, who errs and comes up short. Like I'm totally destroying this quote, but it's that feeling that like, I will not just be a cog in a machine. I'm in the arena that I have always respected so much about clinicians. And when you find yourself in that, the math isn't mathing, or the math is mathing exactly as you might have feared you can understand the value you're contributing and what you are being paid, especially, I cannot stress this enough, especially when you compute it as an hourly wage. Please do. Please, I'm begging everyone who's listening to this, compute your hourly wage, because right now I can tell you right now, Springs and mine, terrible as small business owners, just getting our wheels off the ground. Let us be clear. However, when you start understanding, especially in clinical business of any type, the revenue generated by your work and what you are paid, it is illuminating.
That was my thing. I was like, sister, let me just tell you, because she's got like 800 patients, right?
Yep.
Which in some clinics is a small panel, which is mind blowing to me. But she has 800 patients because she takes time with them, right? I know she does because I talk to them, right? They are having real conversations. She's helping them change their diet. They're getting like healthy guts, and they're
getting
like,
great care.
Yes. Yeah. And so she has these 800 patients that she does an amazing job, right? And like I said, 3 times the number of patients she's seeing than the internal medicine doc. And I'm like, sister, if you were to not have all of this, administrative burden that's just sucking the life out of you and not adding any value to your patients, sorry, not sorry, because it's just true. And you and your patients were like having this discussion, you would be set. Like you would be making so much more money on your own. Like even if you lost half your patients by going independent, you would still be making.
Well, and the quality revenue that you're describing, like one way or another, that's revenue you're generating that someone else is taking. And that does not serve your patients well. When someone else is taking the resources that are designated to you and your team for caring for that patient. Full stop.
I mean, they're literally just using the nurse practitioners. It's
exploitation. It's labor exploitation. Like, I mean, I don't mean to sound crazy, but like
that is literally why I went to NP school, is because when I sat down at the table and I was having these conversations with all of these nurse practitioners, because I was in FQHCs where majority is nurse practitioners, and I didn't even get the respect of the medical director to sit at the table, right, to have these conversations. But I'm like, and we're not paying a single person at this table who is enduring all this training, all this change, all this work. And
the people in the arena. Yeah.
And they're not getting any benefit out of it. And they don't even know. I couldn't sit back and be like, I'm like, who is the person at the table talking for these people? Because they don't even know that.
It's so funny that you say this, because whether it is in nonprofit work, for-profit work, the consistent theme that I have seen again and again and again to solve problems and to align outcomes and income, you get close to the people closest to the work and solve problems from them. Period. Like whether it's a daycare business, a healthcare business, a manufacturing business, like,
but Kim, if you want to just make money.
Oh, whoops. There we go. That's
if you just want to make money and you don't care about the outcomes and you aren't really held accountable for outcomes, then you just get as many people who are ignorant to the fact that they actually have their own power, and you just exploit them until they get burned out and they move on like a horse, like we talked about earlier, and then you just get another horse and you just keep doing that, and you make plenty of money that way, whether it's federal quality.
You'll find it one way or another, because the people who are willing to game the system and exploit the system are able to. I mean, you are so spot on. It is. I'm having a physical reaction to how much what you're saying resonates. The second book or reference that when you were talking before that came to mind is, and I know we've talked about it before, is the book Untamed by Glennon Doyle. And
love that book.
She talks about the caged metaphor. And like when you were talking about, the not realizing that you're in this situation where you are showing up every day for your patients, for your community, here to do your good job as a doctor, as a nurse. If you don't know these realities of how the money works, how the funds flow, I can, number one, almost guarantee that you are being taken advantage of.
Yes.
And it's become a cage.
Yes.
To not know how the money works. You need to understand the outcomes. Of course you do. We are very clear that you need to understand the outcomes as a clinician in this country. I would say that you absolutely cannot sever that from understanding how the money works, because there is no personalized care. There is no freedom in care delivery or receiving if you do not have transparency on the clinical delivery. We're doing a not perfect on that, but we're better there, and transparency on the financial delivery.
Absolutely.
We have no transparency there. And that black box is what is allowing this exploitation and this just misalignment, right? You've said it so well, and it I think it is our theme for today. I'm just going to call it something that Spring said months ago that just lives rent free in my brain, is that the system is rigged against the most generous. And that's what I'm talking about. I'm talking about the FQHC doctors and nurses and, nurse working at the community hospital 20, 30 years, and the doctor who's just showing up every day, trying to make clinic as good as possible for their patients. And they're told, don't worry about the ROI. Don't worry about the money. No, we've got other people worrying about that. That's the cage. That's the cage.
Yes. And, I can hear it because I've had these conversations, and I've had them with myself, right? This theme of, and when we say it's rigged against the generous, if you're listening, I want you to picture, do you identify with these statements, right? One, I don't want to be greedy. I don't want to take too much. I don't want to be unfair. I don't want to insert whatever, right? I don't want to put my needs above those of the group, right? These statements are the kinds of statements that come from people who are generous, right? Because they care about the community, they care about, and there's this assumption that everybody thinks that way.
Absolutely.
And unfortunately, that is
the reality.
not true. And,
yes.
We've talked about the book before, The 48 Laws of Power, which makes me sick to my stomach literally every time I pick it up. And it's so important what you're saying about knowing where the money is. It's not about us becoming selfish and us being
Not
like, I deserve what's mine. You do deserve what's yours.
It's about justice. It is about transparency. It is about freedom of your resources aligning with your outcomes and your values.
And it goes beyond you. If you are providing care, and this is what I had to learn the hard way, right? But if you are providing care and you are not aware of the financial, you are a willing participant in the exploitation of not just you, but the others like you, and to some degree your patients, because 100%. They aren't getting what they deserve. Because I guarantee you, if the person who is controlling the money and like going, don't look over here, it doesn't matter, I can almost guarantee you that person does not care about your patients the way you do. They just don't. Because if they did, they would share with you. They would share the information with you. They couldn't help but share that information.
They would want to make sure, right. They would want you to ask questions. They would want to make sure you understand, so that not only you can understand it, but you can explain it to someone else, and you could explain it to your patient if they ask. That is the kind of transparency that I'm talking about, that Spring is talking about.
That we do in
and
our
it
clinic.
might sound radical.
Every one of our
right. Yes.
People
it's not.
who work
it's
with
not
us,
radical
all of our
to do that.
patients.
Yes.
I'm like, y'all up front. And if at any moment you feel like it's not transparent,
ask a question.
Ask a question.
Yes.
I don't remember to say everything. There's a lot to say. And like, don't expect me to remember all the things that you know or don't know.
Right. I mess up all the time. Let's accept all of these truths.
Yes. And I know that my intention is for us all to be on the same page, for us all to know that everything's being done fair and above board and is to the best of our ability to run a healthy business and take care of everybody, including the people who work here, right? We're not trying to like cheat anybody or hurt anybody, and we're trying to take care of everyone really, really well. That's our goal, right? And let's look at the resources we have. What opportunities do we have in front of us? What do we have that we can do locally or, collaborate or whatever? All of that is just open, right? And so it's like back to that point of, if you're that generous person, it's not acceptable. As much as it feels like the right thing, it's not acceptable for you to be ignorant of where the money's going. It's just not. Because you are the change agent that can bring justice to that money, right? You have the power because you see it, I guarantee you, a different way. And that way that you see it will help change the way that the system is rigged, right? The system is only rigged because we are allowing it to be rigged, right? And that's on us. to stop giving up our power and say, instead of being like, I'm so proud I have a seat at the table, being like, hell no.
I
We
want
can
to
take up
understand how it
75%
works.
of the
Yes.
workforce here. We need 75% representation at this table.
I mean, I think it can look different in different organizations.
Yes.
The point is, your understanding how something works as a clinician has to be part of fair and equitable treatment. It is not severable from it, because if you don't know how the funds are moving, it is far too easy for exploitation to take place. It is far too easy for someone to separate you and therefore your patients from their knowing and the resources that are intended for you and for them. And the simple step is to trust that you are so smart. You have a license to practice. You can understand how the money works. Anyone who tells you, oh, it's too complicated, honestly, I have learned that that's a tell for someone's probably trying to hide something. If the message is, this is too complicated for me to explain or for you to understand. And exactly, do not be satisfied with window dressing. Do not be satisfied with a mere seat at the table. Your understanding, your knowing, your advocacy for yourself and for your patients is part of the job. It is not severable, I think. And certainly, and I'll speak about this as a patient, because, and I've talked about this a little bit before, as a patient, I cannot tell when I walk into an ER if it's safe or not. I have to rely on the clinical judgment of the clinicians there to tell me this place is safe for me to receive care. And right, in any care setting, that is true. The individual conscience of clinicians of being able to say this is safe conditions, not safe conditions, from either a cyber attack or from a financial exploitation perspective, to me, whether it is a tornado or a cyber attack or whatever, the clinicians, unfortunately, you guys are the bulwark. You are between us and chaos. And I love hearing Springs pick up the mantle. Do not be satisfied with crumbs. Do not be satisfied with a mere seat at the table. Demand understanding and participate fully in that advocacy, because you are the ones closest to the work and you are the ones who can bring fairness and transparency to all aspects of the care delivered, the care itself, the clinical and the financial. But no one else can do it but you.
Absolutely. And I also want to speak to another point, because, earlier we were kind of talking about this, and I've been there, right? Like, the reason that I am so passionate about these things is because I have not stepped into my power on these things for too long, right? Because I was like, I don't want to upset the apple cart, and I don't want to make waves. And I made all these excuses for why the people who were in charge were probably smarter and better and all the things than I was, because that's the impression that you're given, right? Is like, oh, well, I went to business school, I went to accounting school, I know these things. And that is true. And I'm not saying that they aren't more skilled and better, for sure, they are. And that doesn't mean that what I am feeling, sensing, thinking has no value, right? So it's like they are both true, right? And
exactly,
for
it's
too
not an
long,
or, it's not.
yeah,
Yes.
for too long, I was treated as if it was an either or, right? And so I was like, oh, okay, well, we're going to have to defer because they're the smarter one. No, that's a false dichotomy. It doesn't have to be either or. It is all and. And so what I can also hear, though, because as I grew in this knowing, right, and started pushing gently, because I didn't still want to upset, right? So it's curiosity. I'm going to ask questions. I become the squeaky wheel, right? You become the person who's like, oh, don't tell her anything, because she's going to keep asking questions. Once you start, she can't stop, right? Because she's going to pick it apart because she wants to understand.
Such a problem child. Such
I
a problem
know.
child.
Gosh,
Yes.
how dare you think
Yes.
for yourself? And so when you start doing that, though, in institutions or groups where you are being exploited, that is not going to be welcomed. It's
Nope.
just the truth of it. And you could be in a position where you might be either forced out or put in positions. I wish that wasn't true. It is just true. Okay. The truth is we have some places and pockets of things that are people that are corrupt and they don't care, and they are going to eliminate the squeaky wheel, right? Not trying to be like scary about it, but I'm just saying, like, it is just, they'll find a way. And to that person, I want to say, one, be brave. Two, there are so many amazing opportunities to work with people who care, who are doing the right thing, who are building things different. Like, I didn't know this whole world existed that I'm a part of now. And it's been here for 2 decades, right? And it has been growing. And so I know that it can feel like you've seen everything, know everything, because whatever, we just think that. But I can tell you that as you have the courage to step out, to say, okay, no, I want to align and work with people who are going to take care of patients in a way that gets us the outcomes they deserve, doesn't bankrupt my patients, because nobody deserves to be bankrupt to be well. Like, that should just be part of a life that we are allowed to live in this very free, amazing country.
And let's just let's make sure that folks hearing us that may be having a reflexive reaction. We pay enough for healthcare for everyone to have amazing healthcare, period. That is, the money is not the problem.
Correct.
And I will say it again and again and again. The money is not the problem. On a per capita basis, which means on an individual person basis, we are orders of magnitude beyond any other nation. And we have ample evidence that we are wasting about a quarter of it and just going purely to profit or losing it or more, right? Like, exactly. That's a conservative estimate. The point is, the money is not the problem. It is what we are doing with the money. And that is why this call to especially clinicians, but hey, I'm a patient. And I'm not saying that you need to be an accountant. Heck no, that was a class that I was very glad to be like, hire a good accountant. Got it. Like, lesson learned in public health school. Yes, indeed. But understanding it enough that I am grounded in those answers, that I understand how the money works. And exactly as you said, that separation from your own power is on purpose if it's happening. And honestly, I think it's a really good tell if you start saying, hey, I think there are ways for us to align our clinical outcomes and our financial outcomes. And I have some ideas. If that falls on deaf ears, if you get shoved out of that conversation, that starts telling you exactly the race that you're running. And if you are in an organization that is running the, we're just going to get bigger and bigger and bigger and bigger and bigger monolith plan, and I've heard plenty of health systems, even in my last year, like, oh, we're just going to get bigger and everyone's going to work for us. And I'm like, okie dokie. My one question is, as we have paid so much more, as money is not the problem, so much money, what's happened with the outcomes? They going up too? Oh, money goes up, outcomes are going in the wrong direction. And so that is why this reclamation of power and engaging in these discussions, it's not that there's a single answer. In fact, there is definitely not a single answer. That's freeing. It's a little scary too, but it means that the future will be paved by folks who take these brave steps to say, hey, I want to make sure I understand this. Didn't go to accounting school. Thank you, accounting team, for doing what you do. Help me understand this, though, because I want to understand it so I can communicate it to another doctor, to another nurse, to my patient if they ask, and help them understand how the resources here align with the outcomes we're trying to create in our community. And if you're not welcome in that conversation, if you are shoved out of that conversation, that is, well, what do they say in poker? Like a little tell? That's a tell. Pretty strong one, actually.
And look, I know both of us do consulting with both patients, employers, and clinicians, right? Because we know that this system is being built different, and it's so possible, right? And so I say that because if you're out there and you're hearing this and you're like, I have no idea where to start, please reach out. Like, we want to help people do it different. We want to empower people it's your power anyway. It's already yours. You don't have to ask anybody for it. It's like, you don't have to get a lobbyist. I had a conversation this weekend about that, and somebody's like, well, yeah, we just need somebody to lobby for blah, blah, blah. And I'm like, no, we don't. No, we don't. It is ours. We just have to start understanding where our choices are. We're giving up the power by not making these choices in a way that aligns with what we want. And we all, in every single stage of this game, have choices that we can make. We don't realize it because we haven't been educated on all those choices on purpose, but they are out there and we can help you understand those choices. One very easy one, like Kim was just saying, ask questions. What money's coming in? Where is it going? And if
Help
you're
me
not,
understand. I want to understand so that I am aligning my work with the outcomes we're trying to create here in our clinic, here in our organization.
and if they're not listening and receptive to that, and you're like, start asking questions, go to the internet, go to look for people, look for your tribe. There are people out there. I could name so many groups, and I'm just not going to go through the whole list because I don't want to seem like it's one or the other, but there are just so many groups out there who are building this type of care. So, and like I said, y'all get our email every time we listen to this. So email us, please ask us questions.
We'd love to help. We really would love to help. I mean, Spring knows that I've been playing with this archipelago metaphor for really the whole summer. And it's the generous and innovative clinicians finding each other, talking with each other. Like, hey, I'm leaving the hospital and hanging my own shingle. Hey, I'm going to step away and try something new. I'm figuring out how to align our time with the vision that I have for what our community should look like. Those conversations are happening. And I think it has felt really alone and scary. Like, honestly, the sense that I get from a lot of the clinicians I know who've considered or taken those leaps in recent years is terror. Is like, oh my God, like I'm stepping into the complete blank white unknown. What I think is amazing is that now this summer, I'm starting to see like, it's an archipelago. There's like a little island over there and a little island. Oh, and you didn't even know that there's like a whole little cluster over there. And this is the point. You're less alone than you think. There are more people agitating towards better than you might think. And the way that you start finding those people, in my experience, is you start asking questions. You start finding, exactly as Spring is saying, your tribe of folks that are like, hey, I have a thought. Hey, what if we tried this? Hey, what are the measures that tell us if we're on the right track or the wrong track? That's good clinical quality improvement. That is good process improvement. That is literally how every good compounding system of returns that exists is built by small little movements day after day after day after day. If someone is dimming that light, it's a tell. If that creativity is not supported, if that dialogue towards how do we continuously align our money and our time towards the outcomes we want, that's a tell.
Mm-hmm.
I think. And I would be so willing to receive someone, telling us otherwise. But in my experience, those are really strong tells that, it's, I'm not saying take your toys and go home, but I'm saying like, if this is the future, right, of like the next 20, 30, 40 years of your career, is this going to work for you? Is this going to be balance that you can be proud of? It's not the only option.
Right. I love that. And the thing that you're describing with clinicians and the terror is the same thing that I see when I talk to patients and when I talk to CEOs, because there's a fear. It's like I have patients who are spending some of them $1,500 a month on premiums, right? That's without any use of the services, right?
That is madness. That is absolute
so
madness.
Much, right? It's like more than their house note sometimes. And so it's like, man, like I'm paying all this money, and it's like I go to my provider, right? And I've got a 15-minute visit where they're triple booked. They're half looking at me. They're at the computer. I'm telling them I don't feel good. They're like, okay, well, here's a script for your Linzess for your constipation. Take it and come back in 6 months if it's not working. And they're like, but wait, I don't want to take a pill. And they're like, oh, non-compliant, and that's it, right? And so it's like the patient's so frustrated, and they're like, how can I spend more money, right? Because if I want to get this type of care that you're talking about, it's cash pay, and I don't know how to spend more money than I'm already spending. And to that person, I would say, okay, first of all, let's go back. Why are you spending $1,500 a month? What are you hoping to get out of your healthcare dollars, right? Maybe there's a way that you can change it. And when I talk to people, a lot of times they've, at their employer, they've selected the best plan because there's the thought of, if I get the best plan, it's going to give me the best outcome. Unfortunately, as we just discussed, not how it's aligned. So there's that. So when you really start figuring out, what do I really want in healthcare, right? And yes, it is kind of confusing. There is a lot to decide. There's like 47 options, right? And you're like, I don't even know what any of these terms mean. Take time to start asking your benefits person, or getting some research on the Google, or the Chat GPT,
Right.
Get some help.
And I just want to add, like, and lean into the folks and the care that feels right. Because again, as a patient, like, I know when I'm with a clinician that I vibe with. And I've had 3 pregnancies. Like, there were definitely a couple where I was like, no, this is not the vibe. We will not be continuing on. I think this idea of the current system being rigged against the most generous. A call to action that I would make is, for patients, for other clinicians, lean into your generous colleagues, lean into the care that feels right, and ask for more of it. Ask for, how could I ask my benefits person for more of this? How might we, design something for the next plan year that could be different, because this is really starting to work. This idea of the most generous, even though they would probably be the first to say, like, I'm not a financial person, I'm not like, the point is,
and they would probably
say
they're not
each other
generous.
Oh, yeah, probably. But the point is, we have to call each other into this conversation. And for me, I'm a big believer in, like, find your coalition of the willing, find the folks that, you can start innovating in your little small group with. It's part of one of my favorite books, Switch by Chip and Dan Heath. It is your, like, find those folks and create a little space for your change agents to meet and have ideas. Lean into each other, lean into the folks that are practicing in a way that you're intrigued by, or the folks that are agitating in a way that you're intrigued by. Because I'm certainly seeing joyful innovation there, not just in Springs Clinic, but in several other clinics where, the pay oftentimes is not what it was, but the clinicians are saying, I would never go back. I would never give this up, because of the care that I get to deliver and the joy that I have in my life. Again,
and just to be fair, the business model, as we fill out this clinic, does work out to where our providers get paid very well, as far as clinicians go, and they have really great hours, and they have amazing relationships with their patients. So that's also really awesome. So even though, yes, starting a business, the hourly wage is like in the negative, it's hilarious. But
truth.
It is growing. Okay, we're going
moving in the right direction. I just saw her financials off camera. Let me be clear, like, they are looking good. It is so cool to see that. But you are so brave, Spring. You are so brave, and I love seeing you shake your head. There's literally no one who knows you that is disagreeing with me right now. You are so brave. I think it's this hope, and it is this faith that is now starting to pay off into very real results for your patients, very real results for your clinic. And you are not the only one by miles that are doing this kind of innovation. And that lights me up.
Same.
Especially from the most generous among us.
And so, I guess I shake my head no, because sometimes when people say things, like, I do appreciate the compliment. Like, it's so sweet. And sometimes when people say things, it's like, I can imagine a person being like, well, I'm too scared to be as brave as Spring, right? And that's the thing that I guess I shake my head no to, is because I don't want somebody to not identify and think they can, right? Because I don't feel brave, right? I feel fed up and just enough bravery or crazy or whatever it is that makes you say maybe, it really is just a maybe, right? And at the same time, I'm like, okay, what's the worst thing that could happen, right? Like, the worst thing is I mean, this is going to sound terrible, but whatever. I'm just saying, like, okay, I lose all the money that I have, right? Which this is my opinion on money, not everybody's, I know. But this is part of why I guess I'm brave, maybe just because I have these kind of like screws loose. Where I was like, money is infinite, right? Like money is just out there. And so it's all to be made at any time. You know, you meet people who make, I don't know, ridiculous amounts of money in a night off of some stupid YouTube video. I don't know. So it's like something can happen, right? So like I just believe that it's like all possible. And so like money almost means nothing to me. Like it doesn't mean nothing, but it almost means nothing to me. So it's like, okay, the worst thing that could happen is I lose all the money that I have trying to make something that I truly believe in happen. I won't be sad, honestly, for me, if I lost all the money that I had and I had to start all the way over, right? And then I'm like, and I'm still a nurse, I'm still a good human. I am still proud of myself every day when I look in the mirror, and I can start over, get a job. I've done that. I've been an employee before. I know I can do that really well. Like I got that going for me. And I'm like, and nursing isn't going anywhere. So like I could go do a job anywhere, anytime, right? So for me, I felt like I really don't have that much to lose by trying to do something that I really, if it does work, right? Oh my gosh, the
Oh my
payoff
gosh,
is
right.
ridiculous. And I'm like, to me, it's a no-brainer. But that's, you know, that's the kind of craziness that I'm at. But I just
I
want people
love
to
it.
know
I
that
mean,
like it doesn't have to be like me, right? Like you don't have to like give up your corporate job that's like
no.
amazing and cushy and like go just full force, right? I've had friends who've started their business on the weekend, like literally a little side
Absolutely.
hustle, right?
One
And
of
like,
one of the case studies we have up on our website is a clinic that we helped open where absolutely like the doctors talk about what they wish they would have done, you know, in retrospect, and also that you can potentially negotiate like a partial appointment on your way out the door. Like everything is possible if you ask and
yes,
if you're willing to start getting creative. I also love your point, and I'm going to say it back a little differently. What I hear you saying is you didn't close off any options for yourself by doing this. You are trying something, you know, different, maybe a lot different, maybe a little different. Everyone's version will be what's hopefully the right fit for them and for their patients and for their community. Get experimental, and it does not need to be all or nothing. It can look differently. It should look different. I think my only point on that is just share with others. Like be continuous in learning from others who fit your vibe, fit how you're trying to innovate, and you're going to keep learning. You're going to keep being able to try new things. I think that is another thing of your bravery that I have always loved, Spring. And I think it is a little bit of like a screw loose thing, because I like that part of myself too. I never want to be closed off from that constantly innovating towards better.
yeah,
The best at getting better. You know, that has been like a phrase of mine for so long. Like I love that obsession with how do we make tomorrow better than today? And it's one of the things I have loved about being a non-clinician, working with clinicians, that constant pursuit of we can do better. And I
yeah.
love that it is opening up this whole new bright green field now that, you know, 5-10 years ago, we couldn't have even imagined that things would be this possible.
I
But
agree.
here we are.
I want to share one more thing about a CEO that I talked to yesterday, and then I would love for us to end with our tiny joys because I
Let's
love
do
that
it.
we do that. Oh, that's my, hey, you got 5 minutes.
5-minute warning, 5-minute warning. I love it.
So yesterday I did a presentation at a company talking about, you know, this different care, right? And there are ways that companies are structuring things where they are doing more of this prevention focused, personalized primary care and still allowing for, you know, major medical and, you know, get your orthopedic and all the things that you need. And so it was really interesting because, you know, we have I'm calling it the 12 RREW. It's getting better, but it's still not great. I know it's an acronym. I thought it might be better.
We'll keep workshopping that. Carry on.
The 12 rings to reconnecting to exceptional wellness. So as we went through that very long named assessment that we have created of all the literature, it's basically like a lit summary, right, of what makes you well, right? And what are the things that each patient has that they can take action on for themselves, right? So like I just think it's so important that
Love
we're
that.
empowered to know, what does that look like? Because I think that is way too confusing for a lot of folks. And that is unfair. And so I'm like, let me just boil it down for you, these 12 things, and so as we were going through that, one of the things we were talking about was how important it is to get sunshine in the middle of the day, which a lot of people are like, oh, you're not supposed to be in the sun in the middle of the day. And I'm like, that's not correct. You will burn easier in the middle of the day. That is correct. So do it in short doses, right? And also work up to the level that you need. But we have a huge problem with people having low vitamin D, and part of that is because we don't get outside. Like, our bodies are meant to be outside. We are meant to see the sun, not just through a window, but outside on our skin. Okay, that is part of why we make vitamin D whenever we go out there, and it helps with our immune system, protective from from diabetes and all these things. Okay, so I'm talking about this, and it was so interesting because the employees at the table were like, we're here between 9 a.m. and 3 p.m., right? Those are the best UVB times. And they're like, so what are we going to do, right? And so they all look at the CEO, and the CEO is like, I could tell there's wheels turning, and it's like, what do I do? What do I do? And he's like, okay, we can get, mobile laptop, and, we can have a workstation outside where people can start. So he starts workshopping these things, right? In the middle of the conversation. And I just want to applaud that level of creativity. A little bit of it was joking, but there was also a little bit of it that was really, I'm
Seriously,
willing to think this through with you.
I love, this is such a nerd thing. I love how might we questions and framing. That's what I'm hearing you describe is it's not I want this, give it to me. It's how might we do more of this? How might we experiment? And now everybody's on the same team experimenting. That to me is so fun.
Yes.
All right.
And I'm going to claim that as my tiny joy because
I love it. You should.
Yeah. Because I just loved watching that happen. I didn't anticipate that, but when it did, I was like, this is magic. I love it. They're thinking of ways that they can help structure their day so that everybody is more well. And I'm like, that's so cool.
Those tiny acts of agency and innovation, exploration, that is a huge joy. That is not a tiny. I love little joys like that, and I'm so with you. All right, my tiny joy is I'm here in Michigan, and I love being in Michigan. I'm staying with a friend, and I have just been so grateful for the time to spend with friends that I love so much, and folks that we were out visiting doctor practices yesterday, and every one of those interactions was joyful. And I am still thinking about them, almost 24 hours later, and I will not stop thinking about them, right? I'm thinking about the last doctor that we chatted with yesterday, and just the giant grin on her face when she was like, I don't have any problem making payroll. And that's a doctor who has innovated. And it was so cool to see because she is practicing in a little house in Ann Arbor, and it is such a cute community. You can see, people walk up to her clinic, and it's, as we have said so many times, I have said so many times on the podcast, it is the kind of care that I think every person wants. And it is so flippin' cool to see a doctor be crushing it, nailing it, loving it, and practicing exactly how I want to. I also got to swing into my kiddo's old pediatrician yesterday and have a total fangirl moment of I love you guys. Those are joyful moments to me that are tiny but are actually so big and I hold on to so deeply. So that's mine today.
Thank you for sharing.
All right, you.
I love you. Thank you for this.
I love you too. Happy day, y'all.
Happy day. Go make it magical.